Hello, my name is Carlos Zanarosa, and I'll be presenting innovation at the bedside regarding safe patient handling using the latest lifting device technology called the Prevalon AirTAP positioning system. Nursing practice involves delivery of safe patient care, provision of comfort in terms of repositioning and turning our patients, and boosting patients up to the head of the bed. And this can cause work-related injuries, including back pain. Healthcare workers continue to record the highest injury rates in the US, costing about $13 billion, with more than 2 million workdays lost in 2011. Nurses and nursing assistants are dealing with injuries and illnesses due to the increase in the overweight and obese population. In 2011, hospitals reported nearly 17,000 injuries that resulted in missed work. These injuries were mainly due to manual lifting of patients who have higher acuity. In 2014, the rate of overexertion injuries across all industries was 33 per 10,000 full-time workers, and by comparison, for hospital workers, it's about twice as much at 68 injuries rate per 10,000. The single greatest risk factor for overexertion injuries is the manual lifting, moving, and repositioning of patients. Hospitals is a dangerous place where injuries and illnesses result in days off from work higher than construction and manufacturing, with higher costs in terms of workers' compensation and use of temporary staff like travel nurses or agency nurses. Registered nurses rank fifth in the incidence of work-related musculoskeletal disorders or WMSD, while CNAs rank second. In fact, at our own unit, one patient care technician is out, and so is one registered nurse on my shift at the I work with. Stop nurses from becoming patients. Nurses reposition their patients frequently in their shift, and this causes continued stress and strain, leading to injury and long-standing pain. The care tasks that risk for injury include lifting or pulling patients towards the head of the bed. It's repositioning task frequently repeated over the course of the workday or the shift is pulling patients towards the head of the bed. And this caused significant risk for WMSD among nurses and nursing assistants. Bartnick and Rice investigated the forces required for moving a patient up in bed using a 3D motion capture system with 4 cameras, and they looked at the sliding sheets. And the results suggested the use of friction reducing sliding sheets reduced potential for musculoskeletal injury. I will use the Rogers Innovation Decision Model. The first stage is the Prevalon AirTAP knowledge. The first stage includes when a staff, personnel, or focus group experience an innovation and it understands its function. At our hospital, nurses who joined the hospital's safe patient handling team discovered the sliding sheet technology called the Prevalon AirTAP sliding sheets technology. It is made by the Sage company, and at their website they claim their Prevalon turn and position systems provide a safe way to reposition our patients while safely achieving a compliance to the turning protocols while reducing strains on our backs, shoulders, wrists, and hand. So this video will show you how this sliding sheet technology is used at the bedside and could lead to less work-related injuries. It's composed of this sheet. First, you reach out is to the head of the bed and measure its shoulder length. Clean out the creases and put it under the patient. And with the hose, we attach it to the sliding sheet, and you can see the power button is right on the hose. The air lifts the patient off the bed, and with air coming out of the bottom like a hovercraft, you can easily slide the patient towards the head of the bed. And these are the wedges which help turn the patient So it's an air-assisted technology that significantly reduces the force required to boost patients. The second step of the Rogers Innovation Decision Theoretical Framework includes if the participating person or the focus group establish a positive and negative attitude towards the innovation. So in this case, the safe patient handling team at our hospital found a positive experience with the use of the Prevalon AirTAP system. The ANA also is convincing as it supports the Nurse and Healthcare Work Protection Act that establishes a national occupational safety standard in eliminating the manual lifting of patients to prevent injuries. And from our own personal and professional experience, from the focus group, we are persuaded with the statistics to try and buy the AirTAP system by Sage. The third stage of Rogers' innovation model is piloting the technology first to a particular unit. The critical care unit where I work with was the chosen pilot to try the Prevalon AirTAP sliding sheets. Initially, it was for a criterion of weights greater than or equal to 65 kilograms. Murray describes this that the decision stage includes staff members can then experience the desirable qualities of the innovation. And as staff, I experienced the ease of boosting and repositioning patients, and most staff agree. The fourth stage is the implementation stage, when all staff starts using the technology. So at this point, the leadership management roles from our CNOs to the directors and our manager are tasked to provide support and logistics in ease in accessing the usage of the Prevalon AirTAP sliding sheets. So we had a Sage sales representative available during the in-service, making sure all staff members signed in and learn. And this person is asked to come annually for our competency classes. The last stage of Rogers' innovation decision model is the confirmation or adoption phase, in which the Prevalent AirTAP materials are pre-ordered as stock, used for patients coming in for admission. It's already placed ahead of time when a patient is coming. The bed is zeroed, the bed scale is zeroed with the sliding sheets material on top. And when the patients come in, the unit clerk orders a new set under the new patient's name to cover expense, and then refilling the stock for the next patient. And from these findings, our patient care director mandated the use of the Prevalent AirTAP on patients 35 kilograms or more at our clinical care unit. Basically, all patients are on an AirTAP system. And also, they decided to put this in policy in terms under the positioning and repositioning device that's accepted by our hospital. An opportunity for interpersonal collaboration is between occupational therapists and nursing students, in which the nurse improved knowledge and skills regarding safe patient transfer, and the occupational therapy students learned safe handling of patients' medical lines during transfers. Conclusion: providing a safe environment for healthcare workers is the priority. The risk of occupational injuries can be significantly reduced, and personal issues, time away from work, restricted duty can be avoided, and the investment in the assisted device and lift equipment will be offset by savings from fewer and less costly workers' compensation claims and loss of productivity, as well as adverse patient events. Essential to the program's success is a mandatory ongoing safety education, providing the material assistive device and lifts ready available, and a no-lift policy, and a culture that supports encourages equipment use. My recommendation is to conduct a research study of the incidence of work-related musculoskeletal disorders rate after using Prevalon AirTAP across a sample population. And here are my references.